Yes, it is composed of cortex and medulla. Certain objects we will cover and we try to discuss now or in the next lecture. Cushing syndrome, the pathogenesis and pathological features, both for adrenal and pituitary. You should recognize the etiology and pathogenesis of and classical clinical features of hyperaldosteronism and hypotypes and causes of hypoadrenalism, comparison between pheochromocytoma and paraganglioma. These are adrenal medullary tumors, and differentiation between the four and five. They are for the next lecture. The adrenal gland composed of cortex and medulla. The normal origin of the cortex is epithelial, whereas the medulla is originated from neuroendocrine tissue. So they are different in origin, different in function, and the neoplasms are also different for the cortex and medulla. Both left and right adrenal glands or suprarenal glands, they are about 4 grams in weight, and they are left and right. What are their shape? This is an adrenal gland covered by perinephric fat, and this is the cortex, which is about 1 centimeter, and the central dark brown or dark brown color is the medulla. What is the shape of this gland, or is it right or left, please? This is a right adrenal gland? Yes, this is a left one. Why? Yes, the right is crescentic in shape because of the hepatic. Yes, because of compression of the hepatic of the liver. And so functionally and embryologically the cortex is different from the medulla. And هذه اللي تميزوها شباب ال 3 distinct layers: zona glomerulosa, zona fasciculata, and zona reticularis. Zona glomerulosa, zona reticularis, and zona fasciculata and zona reticularis. So GFR. This is the zona glomerulosa, like glomeruli of the kidney, like renal glomeruli, and zona fasciculata مثل السعفة, and zona reticularis, undulating nests مثل like a snake. This is a neoplasm. شباب شوفوا, this is a neoplasm of the, شلون نعرفه هذا neoplasm of the adrenal cortex? Because it has the same bright yellow discoloration of the cortex, whereas the medulla شنو قلنا عليها? dark brown color. The gland is about 1 centimeter in thickness. Hyperplasia can be seen as such. This is a neoplasm because it is localized, and this is a hyperplasia because there is diffuse thickening of the cortex. And this is هذا شو يسموه شباب? This is what? إذا هذا neoplasm normal. This is normal. يعني normal, or sometimes it is maybe يعني adrenal. Yes, maybe it is related, maybe it is يعني suppression or atrophy of the adrenal cortex. هسه نجي على الcauses. But here يعني hyperplasia is present, and this is an adenoma with bright yellow discoloration similar to the cortex. Hyperfunction of the adrenal gland, or adrenal gland hyperfunction, or hyperadrenalism. Hyperadrenalism. قلنا هي 3 layers. The glomerulosa secretes steroids or cortisol. The fasciculata secrete aldosterone. يعني affect water and salt and يعني blood volume, and adrenogenital syndrome related to excess or deficiency, excess sex hormone production. As you know, sex hormone are produced by the gonads and produced by the adrenal cortex. Testosterone and estrogen are produced by the adrenal cortex in addition to the gonads, testes, and ovaries. So the adrenal hyperfunction means there is increase in the production of one hormone or more than one hormone. يعني Cushing syndrome ويا hyperaldosteronism ويا adrenogenital syndrome. So one, or Cushing alone, or hyperaldosteronism alone, or adrenogenital alone. So one or more adrenal hormone result in there will be resultant complex systemic disorders as a result of this more than one or different hormone increase or production. What do you expect the cause of Cushing syndrome or hyperaldosteronism or adrenogenital? What do you expect the syndrome, or what do you expect the causes? And what are the causes behind this excess or overproduction of adrenal hormone? دقيقة. هسه احنا نقول in general نقول الادرينال hyperfunction is overproduction of single hormone or more than one hormone for the presentation to become multiple.
Maybe tumor.
Yes, recall
دكتورة ممكن tumor.
شباب recall the normal control or the normal physiology of feedback, stimulation and inhibition. So pituitary and adrenal endocrine tumors and pituitary and endocrine pituitary releasing hormone or endogenous adrenal cortical tumor or exogenous. لا تنسون الإفكت of the pituitary hormones, whether hyperplasia or secretory functioning hormones, اللي هي نسميها secondary Cushing syndrome or secondary hyperaldosteronism or secondary adrenogenital syndrome. Okay, so it can be endogenous or can be primary or secondary. Okay. Cushing syndrome is the effect of excess or overproduction of cortisol from the adrenal cortical cells, especially from the zona glomerulosa. Zona glomerulosa will secrete excess cortisol. What about the presentation or clinical features or major clinical features of Cushing syndrome? The effect of cortisol on the fat distribution to result in fat redistribution due to the effect of cortisol on the glucose and on release of insulin. The result in central obesity around the abdomen and with thinning of the extremities. They call lemon-shaped obesity or central obesity. The cortisol also have the patient develop moon faces and facial plethora. cortisol effect, and weakness and fatigability. This is related to the effect of cortisol, shabab, on muscle, on the bone. The cortisol results in breakdown of protein. Also, hirsutism, excess facial hair or male type or male distribution of hair, any hair or male baldness. Hypertension, the cortisol will cross-react. Cortisol will cross-react with mineralocorticoid receptors, with aldosterone receptors. So the patient will develop hypertension. Also plethora or facial plethora, glucose intolerance and diabetes or abnormal glucose tolerance test, the effect of steroid. Osteoporosis, the patient have osteoporosis or decreased bone density, in addition to neuropsychiatric abnormalities, menstrual abnormalities, female with Cushing syndrome. One of the features نسميها احنا is amenorrhea. Amenorrhea is one of the features of Cushing syndrome, and skin striae in the lower abdomen and the sides of the lower abdomen as a result of protein destruction and induced by protein breakdown induced by excess cortisol. Increase bruisability and poor wound healing. This is one of the effects of cortisol because of its anti-inflammatory effect. This is a summary or for the signs and symptoms of Cushing syndrome. BAM, Cushingoid, B for buffalo hump, and A for amenorrhea, M for moon faces, and C for crazed or crazy or psychosis or abnormal psychiatric manifestation. U for ulceration, impaired wound healing and bruising, ulcerations or ulcers. S for skin changes, or striae or any skin manifestation as a result of breakdown of protein within the skin changes. H for hypertension, and I for infection. Why, Shabab? Why there is an increased incidence of infection in patients with Cushing syndrome?
Because excess cortisol causes immune suppression.
Exactly, excess cortisol causing immune suppression. What about N? N for necrosis of the femoral head as a result of bone changes and osteoporosis. G for glaucoma, eye changes, and O for osteoporosis, skeletal manifestation, bone pain and bone changes, and I for immune suppression, and D for diabetes, okay? This is the moon faces, buffalo hump, and striae, abnormal or fat redistribution induced by cortisol. And the pathogenesis or the main pathological changes in that are, I divide them into four causes. The most common one, about 90% of Cushing syndrome is related to exogenous or prolonged administration of glucocorticoid for therapeutic reasons. Shabab, any idea about the therapeutic reasons of steroid or of cortisol? any idea ليش يعني فشي كلش كمان وشايفيه أكيد وسامعين بيه. What are the treatments يعني in which cortisol is given or steroids are given for long duration to cause this side effect, Cushing syndrome, which is an iatrogenic Cushing syndrome, in which the patient have a treatment for inflammatory process like rheumatoid arthritis, like autoimmune disease. Yes, asthma, rheumatoid arthritis, eczema, chronic eczema, and chronic immune suppression. منو هذول chronic immune suppression أو for immune suppression؟ الrenal transplant, liver transplant, patient with يعني connective tissue disease and so on. So patients have, this is called iatrogenic Cushing syndrome caused by exogenous steroid administration for a long time, represent up to 90% of cases of Cushing syndrome or primary or not primary, it is adrenal hyper or features of Cushing syndrome or over signs and symptoms of cortisol excess. Whereas the other less common causes including pituitary hypersecretion of ACTH, that is basophilic microadenoma or قلنا microadenoma. يعني شو نقصد شباب basophilic microadenoma? We mean معناها it is presented as features of Cushing syndrome, مو صحيح? Which is related to functioning pituitary adenoma. So it is presented with manifestation of Cushing syndrome and as a result of its effect on the adrenal gland. Both adrenal gland are affected. Pituitary, basophilic microadenoma secreting excess ACTH or corticotroph adenoma or ACTH secreting adenoma. Ectopic production of ACTH or corticotroph releasing hormone by ectopic non-endocrine tumor like أشهر واحد دائما نقول اللي هو small cell lung cancer, carcinoid tumor, thymoma, lymphoma, and so on. Adrenal adenoma, carcinoma, and hyperplasia secreting a lot of excess cortisol. This is ACTH independent. شباب, regarding لو نشوف المورphology of the adrenal gland in all of these four presentations. بالبدء أول شيء نقول in patient with exogenous estrogen, patient يأخذ a lot of أو exogenous administration for long time. What happened to his adrenal glands?
Cortical atrophy.
Cortical atrophy, exactly. The patient developed cortical atrophy. مو صحيح؟ أكو فد exogenous source of cortisol administration, so there is feedback inhibition or negative inhibition to suppress the cortex to secrete cortisol. زين, هذول البيشنت من حنسوي لهم withdrawal they develop نسميها Cushing crisis, يعني features of hypotension, shock as a result of يعني ماكو, there is no the adrenal cortex cannot respond to the stressful condition because it is atrophied for a long time. Okay, so cortical atrophy, bilateral or unilateral شباب?
bilateral.
Bilateral cortical atrophy as a result of exogenous suppression. Okay. Whereas in pituitary hypersecretion of ACTH, what about the adrenal glands? They are atrophic, hyperplastic, neoplastic.
Hyperplastic.
Yes, hyperplasia of both of the adrenal, because they are under the control of ACTH or يعني هذا ال ACTH secretion by pituitary adenoma without negative feedback again. There is an adenoma unresponsive to the negative feedback. So the glands are hyperplastic bilaterally hyperplastic. And the ectopic production ايش تتوقعون؟ ACTH. What about the adrenal cortex? الectopic مثل الexogenous نفس الشيء. There is an exogenous أو extra cortical ACTH secretion. مو صحيح؟ So the glands شبيها ectopic ACTH production معناها الجلاندز both of them are hyperplastic. مو صحيح؟ both of the the glands are bilaterally hyperplastic because of excess ACTH stimulation. Okay, whereas in adrenal adenoma, adrenal carcinoma or hyperplasia هذا شو تقولون عليها؟ Is it bilateral or unilateral or what? Unilateral. عادة قلنا الأدينوما is single, carcinoma is also single or unilateral, and they are independent to the secretion of ACTH. وش تتوقعون هنا إذا هي functioning adenoma ال ACTH يصير بيه؟ Yes, it will be suppressed. Okay. Again, the most common cause is exogenous long-standing administration of cortisol for inflammatory or autoimmune suppression. Pituitary, the morphologically, the pituitary gland will be hyaline. They develop hyaline degeneration of non-tumorous corticotroph. Hyaline degeneration. The neoplastic corticotroph, they are show neoplastic proliferation, and there is a hyaline degeneration or hypopituitarism or compression of the non-neoplastic اللي هي adjacent إذا acidophil أو إذا another corticotroph. Whereas the adrenals, they have diffused hyperplasia and ACTH secreting adenoma or ectopic ACTH secretion or a releasing hormone excess from ectopic source, or nodular hyperplasia, nodularity, or this is, let us say, in nodularity ممكن تكون in case of مثلا ectopic and in which there is uneven response مثل nodular hyperplasia of colloid of thyroid. Adenoma or carcinoma, the adrenal have an مثل ما شفتوها بالبداية شباب tan bright discoloration of a well-defined mass within the cortex, or can be rarely carcinoma اللي هي أقل less than 1%. Carcinoma is rare in endocrine glands. Adenoma is more common. Bilateral cortical atrophy in case of exogenous administration of the estrogen, and also atrophied in case of bilateral atrophy in case of exogenous administration of cortisol. Yes. The second part to be affected, the zona fasciculata prime to be affected is excess secretion of aldosterone. it is a small group of closely related uncommon syndromes characterized by chronic excess aldosterone secretion independent of renin-angiotensin system, characterized by suppression of plasma renin activity, hypokalemia, sodium retention, and hypertension. The common or the cause is single unilateral aldosterone-producing adrenocortical adenoma. 35 represent 35% of the cases in which there is single unilateral adenoma, which is aldosterone-producing adenoma. شباب سامعين بال surgically correctable or correctable hypertension اللي هو it represent من أخذنا الهايبرتنشن العام قلنا 95 about 95% is idiopathic essential hypertension and about 5% of hypertension is the شنو سميناه secondary yes secondary hypertension. شنو يعني secondary or surgically correctable? There is an adrenal lesion. Another cause another than essential hypertension or endogenous increase in peripheral resistance, peripheral vascular resistance. There is an adenoma secreting aldosterone from the adrenal gland, in which there is decrease in potassium and hypernatremia and increase in blood pressure. Okay. ياخذ البيشنت يطلع عنده hypertension ياخذ treatment no response to treatment. Here the lesion or the hypertension is unresponsive to treatment, unresponsive to antihypertensive therapy. Okay, but it is surgically correctable or as a result of نسميها Conn's syndrome mean adenoma producing excess aldosterone. Whereas the most common or higher in percentage is the bilateral idiopathic adrenocortical hyperplasia. Adrenocortical hyperplasia, which is idiopathic or of unknown cause. 3, aldosterone producing adrenocortical carcinoma. Here the carcinoma is functioning مثل adenoma, but it is less common. Or ectopic production of aldosterone, which is also rare. The pathogenesis here in primary hyperaldosteronism, there is increase in the action of aldosterone, potassium secretion, potassium the level of potassium will be lowered, hypokalemia, and sodium reabsorption, increase in sodium or sodium retention or hypernatremia, and as a result of sodium reabsorption in the distal tubule. So in the distal tubule, there is excess secretion of potassium and reabsorption of sodium with resultant water retention and hypertension and hyperaldosteronism. So this effect of aldosterone has 2 effects on blood volume, expansion of the blood volume secondary to sodium retention, water retention, and increase vascular resistance. Increase in peripheral vascular resistance result in hypertension, which is unresponsive to therapy. So this is secondary. This is the trait clinically. The patient with Conn's syndrome or patient with primary hyperaldosteronism has a trait of hypertension that is unresponsive to treatment, hypokalemia, hypertension, hypokalemia, and low renin-angiotensin or low renin level. No response to renin, or the renin here is not stimulated. This is a picture showed you the adrenal cortical adenoma or aldosterone secreting cortical adenoma, or called aldosteronoma. You can recognize the bright yellow discoloration in the cortical, the adrenal cortex, and this is the dark brown medulla, mean the tumor. بنفتحها نقول نشوف هيك, this is the bright discoloration, well demarcated neoplasm, so it is related to cortical adenoma. Well, levels or the laboratory finding will assist that هي مثلا aldosterone secreting or or cortisol secreting مثلا. This is the zona fasciculata proliferation in cortical adenoma corresponds to zona. This is the adrenal cortical adenoma secreting aldosterone, and the fascicular pattern of zona fasciculata corresponding to the location of excess aldosterone secretion on the normal histology. Again, this is an adenoma in patient with Conn's syndrome, cortical adenoma in patient with Conn's syndrome, in which there is hypokalemia, genetrate hypertension, hypokalemia, and low renin. Hypertension, secondary hypertension, hypokalemia, and low serum renin, with a neoplasm in the adrenal cortex with bright yellow discoloration related to the adrenal cortex. Congenital adrenal hyperplasia. The third part, the zona reticularis, excess secretion. It is also called adrenal virilism. Virilism means accentuation or augmentation of male phenotype or male features in female patients. Occur due to deficiency or lack of an enzyme involved in biosynthesis of cortical steroid, particularly cortisol. Other channel and pathway will lead to increased production of androgen, result in virilism. So a single or multiple, it can be associated with Cushing syndrome, it can be occur alone with features or clinical features of virilism. Cortical deficiency results in ACTH. Cortisol deficiency result in ACTH, increased secretion. When there is cortisol deficiency for any cause, or for مثلا for deficiency as a result for deficiency of cortisol from the adrenal cortex, result in secondary or result in positive feedback mechanism. ACTH will be increased and result in adrenal hyperplasia. من يصير adrenal hyperplasia, adrenal cortical hyperplasia. This have an effect on the sex hormone producing cells in the zona reticularis. Okay. Hypofunction of the adrenal cortex. Hypofunction of the adrenal cortex. Hypofunction or hypoadrenalism, it is mainly caused by primary acute adrenocortical insufficiency. Primary acute adrenocortical insufficiency. This is result after بس قلنا شو وقت تصير هذه شباب؟ adrenal crisis. Hypofunction of adrenal cortex, sudden withdrawal of exogenous estrogen, cortisol or steroid administration for taken for a long time for chronic use. Patient after withdrawal, patient may have or may develop adrenal crisis, that is features of result from adrenocortical insufficiency and failure to adrenal cortex to secrete cortisol, a response to stress, a response to خاصة تصير after مثلا patient have infection or have surgery or have a trauma after failure to compensate for the deficiency of the as a result of cortisol deficiency from the adrenal cortex, from the zona glomerulus. Primary chronic adrenocortical insufficiency, primary chronic adrenocortical insufficiency, which is an Addison syndrome. Addison syndrome, this is acute, called adrenal crisis, and acute withdrawal, sudden withdrawal of therapy, of steroid therapy, and here primary chronic adrenocortical insufficiency or Addison syndrome, the axil Cushing syndrome, after adrenocortical insufficiency, chronic type. مثلا for, let us say, autoimmune adrenalitis or infection or hemorrhage or damage to any cause that result in damage or hemorrhage or autoimmune destruction of the adrenal cortex will result in adrenocortical insufficiency with Addison's syndrome and all its manifestations. The secondary adrenocortical insufficiency, as a result of pituitary hypofunction or pituitary destruction or impairment of release of ACTH, ACTH or from the corticotroph cells or the hypothalamic releasing hormone. This is secondary adrenocortical insufficiency. So the primary acute type that, as I say, result from and precipitated in stressful condition, infection, surgery, trauma, burn, or any cause of acute stress. The patient required immediate increase in steroid output from the gland, which is incapable of respond to this stressful condition. Also result from too rapid withdrawal. فدائما لازم يكون شباب if you hear the withdrawal of steroid therapy or exogenous therapy should be gradual. يسموها tapering of steroid therapy, يعني على مدى أسبوع أو أسبوعين أو شهر يسووا لها tapering، يعني يقطعوها بالتدريج إلى أن يصير gradual stimulation of the adrenal cortex to secrete cortisol, because the adrenals are suppressed for long time to secrete cortisol by the exogenous estrogen administration. Or in patient with adrenalectomy, هذول اللي عندهم adrenalectomy, they should have supplied by the cortisol gradually. And massive destruction of the adrenals, massive destruction, sudden massive destruction, like in bleeding or ischemia to the adrenal gland, or in patient following prolonged and difficult delivery and labor, hypoxia and extensive bleeding, post-surgical, هذه اللي نقول عليها iatrogenic or bleeding or hemorrhage or necrosis within the adrenal gland, or massive hemorrhage and bacteremia. هذا في الترم خاص نسميه Waterhouse-Friderichsen syndrome, massive bleeding into the adrenal gland in case of bacteremia. So these are the main causes of acute adrenocortical insufficiency in patient with suppressed adrenal cortex. Waterhouse-Friderichsen syndrome in patient with septicemia caused by meningocoque or by gonocoque, or pneumococci or staphylococci, patient have rapidly progressive hypotension and shock and widespread purpura and bleeding, disseminated intravascular coagulopathy. Patient develop adrenocortical insufficiency as a result of massive bleeding in both glands bilaterally, called Waterhouse-Friderichsen syndrome. After bacteremia or septicemia, patient develop bleeding or wide disseminated intravascular coagulopathy. Whereas the chronic type, the chronic primary chronic adrenocortical insufficiency, shabab. What about the primary adrenocortical insufficiency? Yes, primary adrenocortical insufficiency or Addison's disease in patient with chronic destruction of the adrenal cortex as a result of any type of destruction like autoimmune adrenalitis. ليش نسميه chronic شباب؟ ليش نسميه chronic؟ لأنه مثل الأكيوت صار sudden bleeding, sudden clot, disseminated intravascular coagulopathy, sudden shock وصار destruction كل الجلاند. Whereas autoimmune adrenalitis مثل الهاشيموتو مثل السيالدينيتس type, autoimmune type, there will be gradual destruction of the adrenocortical parenchyma, gradual destruction. مو صحيح؟ مو هيك قلنا بالهاشيموتو ثايرويدايتس شنو قلنا بالبداية شي يصير؟ هو autoimmune، هذا autoimmune وهذا autoimmune adrenalitis أو autoimmune thyroiditis. شو يصير بالبداية؟ what is the ongoing process, destructive process? That is the destruction is gradual, long term or sudden, massive. Autoimmune process يعني تاخذ long time, many years to be destructed totally. Many years are required for total destruction of the adrenal cortex and for the manifestation of adrenocortical insufficiency to develop. Okay. Tuberculosis and metastatic cancer are another infiltrative causes. Infiltration by chronic disease or by long-standing disease can result in this chronic type of adrenocortical insufficiency. The presentation presented with insidiously as weakness, fatigability due to deficiency of cortisol, anorexia, nausea and vomiting, and weight loss and hypotension. شوفوا شباب axial Cushing syndrome, weight loss, axial weight gain or central obesity, hypotension, vice versa or versus hypertension in Cushing syndrome, hyperpigmentation of the skin, because of the excess ACTH. ليش يصير hyperpigmentation of the skin؟ يصير عندهم لونهم يصير أسمر أو يصير hyperpigmentation due to excess ACTH secretion, which will stimulate the melanocyte stimulating hormone or melanocyte stimulating hormone, which will result in this hyperpigmentation of the patient in Addison's disease. Low serum sodium versus high or hypernatremia and Cushing, chloride, bicarbonate, and glucose, all of them are show low level. Hypoglycemia versus or in contrast to hyperglycemia and impaired glucose tolerance in Cushing syndrome. Low cortisol level indicate, in addition to these manifestations, indicate chronic or acute, but according to the cause, according to the precipitating cause. Also, there is hyper natremia. Secondary adrenocortical insufficiency, secondary adrenocortical insufficiency. That is hyponatremia or hyponatremia. Yes, hyponatremia. Yes, hyponatremia and hyperkalemia. Axial Cushing syndrome, hypotension. Secondary adrenocortical insufficiency. من نسمع secondary معناها شنو؟ Related to the pituitary trophic hormone secretion, in which there is disorder in the hypothalamus and pituitary, like destruction, bleeding, metastatic cancer in the pituitary and the hypothalamus, infection, infarction, any cause in any intracranial cause or destruction of the hypothalamus and pituitary impair the ACTH secretion or reduce the ACTH secretion, that is the corticotroph stimulating hormone, and hypoadrenalism. Prolonged administration of exogenous corticosteroid, that it also will suppress. This is a positive feedback mechanism, or this will causing suppression of ACTH. Prolonged administration of glucocorticoid, exogenous glucocorticoid, will suppress also the ACTH and suppresses the adrenal function. Clinically, the patient lack of hyperpigmentation. Sorry, this is the secondary type. Secondary type, these features differentiate secondary from primary. Secondary from primary adrenocortical insufficiency, and so there is lack of hyperpigmentation because the ACTH is already lowered, so there is no stimulation of the melanocytes by the melanin stimulating hormone, no marked hyponatremia and hyperkalemia in the secondary type, and low level of plasma ACTH. This is due to secondary pituitary or necrosis of the pituitary or hypothalamus. And there is a rapid or prompt response to ACTH administration. Rapid after administration of ACTH, there will be correction of this secondary adrenocortical insufficiency. Yes. And also, sometimes there is non-functioning tumor. Shabab, in which way, where is the non-functioning tumor or non-functional tumor? Here. Secondary type, any idea about non-functional tumor here, causing secondary adrenocortical insufficiency? Any idea? شباب, this is the اللي سميناها non-secretory or non-functioning pituitary adenoma or non-functioning pituitary.
بالبيتيوتري بنسوي
Yes.
contraction على البيتيوتري.
Yes, هذا اللي قلنا عليه presented as macro adenoma, non-functioning pituitary adenoma or non-functioning or يعني non-secretory adenoma. Then, this tumor presented mainly with mass effect, with the effect of mass effect اللي هي شنو يا شباب؟ mass effect, features of
benign tumor at malignant site.
Yes, features of increased intracranial pressure and compression. Yes, هذه كلها. Yes, features of increased intracranial pressure, visual field disturbances, and what? And on the effect on the gland itself, the another non-corticotroph secretory cells will be destructed, or corticotroph secreting cells will be destructed. صحيح؟ necrosis of the or damage of the corticotroph or thyrotropic, the pituitary, anterior pituitary itself. So, non-functioning tumor can be one of the causes of secondary adrenocortical insufficiency. Adrenocortical insufficiency. So no more ACTH to be secreted by the corticotroph, and the patient have rapid response to ACTH exogenous administration. And it is differentiated by lack of hyperpigmentation seen in the primary type, in which there is excess ACTH secretion by the pituitary. These are neoplasms, adenoma, and adrenal cortex, shabab, and the adrenal cortex. What are the features here? What we say about this, the feature of this lesion previously?
Hyperplasia.
Yes, it is neoplastic. Hyperplasia is usually diffused. Hyperplasia is usually diffused and bilateral. This is an neoplasm. This is an adenoma. And it is we know it is cortical in origin by the bright yellow discoloration, well localization, and solitary. صحيح solitary here, مو multiple, solitary, not diffused, and unilateral عادة الأدينوما. Okay. And thank you about, I will send you an attendance form now. أريدكم تسجلون على هذا attendance form شباب.